Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad that you all could be with us. Also, those joining us through iHeartRadio and Amazon Music Podcast, we're glad you all could be with us as well. This is part of our For Your Health segment, and this is something that's going to be important for all of you guys out there. Approximately 37 million Americans are affected by chronic kidney disease, or CKD as it's called. Unfortunately, the vast majority don't even realize it. Chronic kidney disease is a serious condition that often doesn't have any symptoms until it's at an advanced stage. Well, how can there then be some help for those who are diagnosed with CKD, as well as information about treatment? We're here to talk to us about that. We're excited to welcome Dr. Neil Skolnik to our program. We're going to talk to Dr. Skolnik not only about CKD and how serious it is, but also what you all can find out about the latest developments. Dr. Skolnik, thank you so much for the time. Really appreciate it.
Cyrus, it's such a pleasure to be here and to be able to talk to the people in Mississippi.
Yeah, the pleasure's definitely all ours. So, I think one of the things we hear about kidney disease, Dr. Skolnik, but talk to us about chronic kidney disease and who's at risk for it.
That's a great question, Cyrus. Our kidneys are important to our body. They are the organ that filters out the toxins that build up through normal metabolism, through working all day, through eating, etc., and they can, over time, begin to fail. That's chronic kidney disease. And there are a lot of people at risk. People who have obesity or hypertension or diabetes are the people who are at the highest risk.
So if someone may be suffering from chronic kidney disease, Dr. Skolnik, how is it diagnosed then?
Yeah, it's critically important because until it's very advanced, you don't even know that you have it. So it's important to mention to your doctor that you'd like to know, because remember, 90% of people with chronic kidney disease don't know they have it, and 1 out of 7 people in the United States actually have chronic kidney disease. So all you have to do is get a simple blood test where if you had high blood pressure or diabetes, you've already gotten that test. You just may not have been told whether or not you have chronic kidney disease. All it takes is a simple blood test and a urine test, and your doctor can talk to you about whether or not you have chronic kidney disease. And if you do, what to do about it.
Well, that leads us to some of these latest developments then, Dr. Skolnik, because if someone is, they discover they have chronic kidney disease, then what can you tell us about the new way that it's now being treated?
A great question, because for years there was not a whole lot that you could do. And just 2 weeks ago, after a long period of intense study, the FDA approved a new medication, Farxiga, that works on the kidneys to slow the progression of chronic kidney disease. So it's a really exciting time for people who have chronic kidney disease, because there's something available that you can do something about. And that's why I've decided to partner with AstraZeneca in order to get the word out. Now, like any medicine, Farxiga isn't for everybody. You need to talk to your doctor if you have chronic kidney disease to decide whether it is for you.
So you bring up a really good point, because as we are now, moving around more, Dr. Skolnik, people are now maybe even keeping their doctor's appointments that they were not keeping over the past year, or making those doctor's appointments. Is communication with your physician, is that kind of the key then for not only seeing if you have CKD, but also finding out about treatment?
Communication, Cyrus, is always critical to every relationship, and that's true, of course, of doctor-patient relationships, because when we are at our best, right, doctors and patients are partners in helping patients get the best outcomes, and that's certainly true for chronic kidney disease.
So here we have some great information about not only chronic kidney disease, but also these latest developments in treating it as well. Our guest is Dr. Neil Skolnik. Dr. Skolnik, how can our audience find out more information?
Yeah, a good way to find out more information is to go to Farxiga.com. There's a ton of information there from which you can learn a lot. Cyrus, it's such a pleasure, and thank you for the privilege to be here talking to people in Mississippi.
Hey, the pleasure's definitely all mine. We appreciate you taking out the time and all the great work that you are doing. We're going to make sure that we link that website up for our audience as well. Again, everyone, Farxiga.com is that website, but we will be posting it for those joining us on our online affiliates, as well as, of course, on the Facebook page for our radio station here in Mississippi. Until next time, I'm your host, Cyrus Webb, saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live today. Now let's go make today amazing. Take care.